The process evaluation in INTERACT3 has been designed at the beginning, which aims to understand the feasibility, acceptability, and also the implementation of the care bundle within the INTERACT3, which is the intervention. So because the care bundle has involved 4 components, include intensive blood pressure lowering, blood glucose level control, temperature control, and also the anticoagulate reversal. So it's a kind of complex intervention, and it's very important to looking at like if the components has been delivered as planned, and also to looking at what are the barriers and facilitators to implement this each of the components. So that's why we designed the process evaluation in the INTERACT3. And for this design, we used a mixed method approach, which include to collect some survey and hospital organization questionnaire, which are mostly the quantitative data. And also we did some focus group discussion with the investigators from the 10 countries we recruited patients from, and also the interviews with the investigators, both clinicians and also the nurses, to discuss like what their conceptions and also what are the barriers and anything else like their feedbacks of the care bundle. So we actually has involved nearly 26 sites for the process evaluation, and this was sampled according to the criteria which called purposive sampling. So we chose the sites which are mostly representative from the whole sites recruited in the INTERACT3. And we did interviews and focus group discussion and also analyzed the results. So we found that overall, the care bundle, which is the implementation of the intervention, is accepted and also it's feasible. But there are some feedbacks of like barriers to reach the blood pressure target, and also to reach the blood glucose level control. For example, for the blood pressure lowering, some barriers would be include shortage of the staff resources, because we in intervention we require them to do frequent monitoring on that. So particularly during the COVID pandemic, there is shortage of staff, so it's difficult for them to implement this kind of frequent monitoring. And also, there are some barriers mentioned by the clinicians that the multiple department collaboration, which was involved the emergency department and also neurosurgical department, sometimes the communication is difficult because when we're trying to recruit patients, we have to initiate the intervention as soon as possible. But if the patients have been admitted in the emergency department due to some reasons, for example, the workload, and also, the emergency is very busy. So for them, it's difficult for them to initiate this intervention as soon as possible. Because from the INTERACT3, we have got the main result published, and we found that the care bundle is there is solid evidence that the care bundle can improve patient recovery for the intracerebral hemorrhage. So we think for the clinical guidelines, and this evidence should be considered and also to be applied to the low sources settings to improve the patient's recovery. So we decided to do a dissemination and implementation campaign based on the INTERACT3 results. So we hope as many as the hospitals and also the stroke associations and societies, they can have attention on the results of INTERACT3, and hope we can, there are some protocol changes in the local hospitals, as well as some guideline management changes and improve. And also probably policy changes in some countries, particularly in those with have short funding for the equipment and medication supplies, so that there are many people would be affected by those changes, and probably many lives can be saved from this care bundle.